Hello, my name is Kay Catrice, the founder of Butterfly University. And in today's video, I'm going to be talking about what is lupus. Okay, so I was diagnosed in 2015 with a chronic disease called lupus. Okay, now lupus is most commonly, when you hear somebody say lupus, let me back up. When you hear somebody say lupus, um, the first thing that you would think of is SLE lupus, okay? And SLE lupus stands for systemic lupus erythematosus. I think that's how you say that. Okay, and so it is a chronic autoimmune disease that can affect any organ in the body, the brain, the skin, the kidneys. It loves the kidneys, the lungs, the heart, your joints, and the spine. It can affect any part of your body. Okay, now most people with lupus have an overactive and misdirected autoimmune not autoimmune, a misdirected immune system. So your so your immune system pretty much attacks itself. So your body attacks itself. Pretty much is what lupus does. Okay. Now SLE is considered the most serious form of lupus, but it can range from mildly affecting you to severely affecting you, affecting multiple organs and joints. Okay, there are four different types. There is the neonatal, which is what babies develop or get. There's discoid lupus, which affects the skin. There's SLE, which is the most common and most serious form. And then there's the drug-induced lupus, which is triggered by certain medications. And once you stop taking those medications, it goes away. Okay. Now, lupus is difficult to diagnose because it mimics so many other different illnesses. That's why it's kind of like called an imitator, because it has the exact same symptoms as diseases like scleroderma, rheumatoid arthritis. And so these are connective tissue diseases. And so lupus will imitate the symptoms of other diseases, which can explain why it may take so long for you to get a diagnosis. Now, fortunately, I was diagnosed I started having symptoms back in December of 2014, and by May of 2015, I was diagnosed. However, I've been having symptoms on and off, like intermittent symptoms ever since I was about 8 years old. So now that lupus has gone full-fledged, it's fully active, I'm seeing all of those symptoms that I saw, intermittently. I'm seeing them all now on a regular, consistent basis. Okay, so some of the symptoms that you may experience with lupus are extreme fatigue, fever, joint pain, stiffness, and swelling. The butterfly rash on your face. For some people, the discoloration right here, you may have the discoloration. You may not technically get the rash per se, but you get the discoloration. As you can see, I don't know if you guys can see it. Let me see if I made this lighter. Let me adjust the light. Let's see, I don't know if you guys can see right here, especially up in here. And then right here, it's darker. It's not as light. It's, it got darker. It didn't get light like up here. Okay. Also, you can not only have the rash on your face, but you can also get it like on your thighs. I do have a rash on my thighs that comes and goes. Um, let's see here. Oh, photosensitivity. Being out in the sun can drain your energy and cause other issues. Um, Fingers and toes that turn white or blue in cold temperatures or during stressful times. That is attributed to what is the Raynaud's phenomenon. Right now, my hands are normal color, so I can't show you guys. But in a future video, I will record a video when my hands are blue, just so that you can see what Raynaud's looks like. Shortness of breath. Chest pain, and the chest pain normally comes from pleurisy, which is an inflammation of the lining of your lungs. Also headaches, confusion, memory loss, anemia, edema in the feet, hands, and legs, and around your eyes. Sometimes when I wake up, my eyes are like almost swollen shut. Mouth sores, and nose ulcers. And there are more symptoms because, again, lupus affects everybody differently. So while, one person may have the headaches, the confusion, the brain fog, and the joint pain, somebody else may have severe depression, anxiety, kidney involvement, lung involvement, heart involvement. Now, doctors don't know exactly what causes lupus. Some doctors think it's genetics. Others think it's your hormones, your environment. Me personally, I believe a lot of it has to do with what we consume, what we eat. Not just what we eat, as far as our physical bodies, but also the things that we consume as far as what we hear, what we see as well. Now, a person's genes may increase the chances of them developing lupus. Now, it was unbeknown to me that I had family on my father's side that had lupus. I have a cousin that has lupus. I did not know that she had lupus until after I was diagnosed. Also, an environmental trigger may set off the illness or bring on a flare. So I did not, like I said earlier, my lupus symptoms were really intermittently. I got diagnosed at 31. It's been 4 years. So I was almost 32 when I got diagnosed. It was after I had my last child. And I started experiencing the swelling in my hands and my hands turning blue. Anytime I got cold, and I thought it was a circulation issue, and then come to find out that I had lupus. Some common environmental triggers are UV rays from the sun, or fluorescent bulbs, any drugs that have sulfur in it, like Bactrim. Let's see here. Penicillin can cause a flare in some people. Any type of infection, cold, or viral illness can bring on a flare, or even trigger the disease to become active. Physical harm, pregnancy, or giving birth. Anything that causes stress to your body can bring on a flare or bring on onset of, active illness, which, like I said, that's what happened to me. After I had my last baby, it went a year afterwards, it went active. And then lupus is more common in African Americans, Hispanics, and Asian Americans. Now, anybody can get lupus, but it is more common in those racial groups. And also, women are, you see a lot of women with this disease. Men do get it. but it's more common in women, more common in African American women, especially Hispanics and Asian Americans. All right, so that's just a quick overview of what lupus is. Just to give you an idea for those of you who don't know what lupus is, or for those of you who might think you have lupus, or you've been newly diagnosed and you're like, what is lupus? Just a quick overview for you. So if you found value in this video, please subscribe to my channel, Butterfly University. Also, drop me a comment. Let me know if you have any questions about lupus. You can, drop your questions in the comments. I'll be more than happy to answer any questions that you may have. Like I said, I've been diagnosed since 2015, since May of 2015. So last month made 4 years of me being diagnosed with lupus. But I've had symptoms, intermittently since I was 8 years old. So I'm no stranger to this disease called lupus. All right. And just leaving you with a quick little nugget. In asking for help, you are learning how to receive. So if you're somebody who's afraid of asking for help, don't feel like a wuss. Don't feel like I can't do it. You kind of get down. Don't feel that way, because you're learning how to receive. So if somebody's helping you, that means they're giving you. Learn to receive with an open heart, and you'll get more out of life. Thank you for watching, and have a great day. See you on the next video.